I'm speaking on behalf of Queensland Voice today, which is an organisation that's been around for a little while now, since about 2004, but not many people may have heard of it. We're a consumer and carer organisation, and we were formed through an alliance of people with a lived experience, and by lived experience we mean consumers and carers. And we were set up to do a number of different things. The first thing was to encourage, educate and support the members of the Queensland Voice and people accessing services and health services to fully participate in those programs, and do that by being involved within service planning, delivery, monitoring, so seeing how that's going, and in the evaluation process, so actively being involved within that process and really participating, so consumer participation really. The other thing that we do, and we're currently not funded for, is we advocate on behalf of people to make sure that services are working. There are parts of this program that we've been running for quite a while that are unfunded. Queensland Voice has been recently funded for a project which I will talk about shortly, but we also have some parts of our project which are currently still unfunded, and I guess I'd like to start off by saying that we have some amazing committee members that go out there and speak at quite a high level and do it voluntarily and speak on behalf of consumers and carers. And you might have seen Jan Kilton this morning, Noel Muller, people like that who actually go out there on a daily basis and volunteer, and I think that's really important to mention. The other thing that we do is we send out a weekly newsletter which lets people know what's going on within the sector, and this was first of all aimed for consumers and carers, so it let people know what information is out there, what they need to know. It also has started to be a bit of a resource for people to know what groups are happening, what training's happening, and so services currently send us information about things that happen everywhere around Queensland, and we send that out in a weekly email blast, and that's happened whether we're a paid service or not. Part of the work and the reason why I've come here today is because Queensland Voice has been funded to do a project called the Participation and Engagement Project. I'll just get my notes, which is a bit of a mouthful really. Basically it's supporting the sector with consumer participation, peer work and mentoring within that space. So we'll be working with consumers or people accessing services. I like to think of them as people, but to clearly define it, we mean consumers. We'll be working with non-government organisations who are funded from Queensland Health, so the community managed mental health programs that recently received funding, and some of the services that were already existing, so HAS programs, housing and support programs, and the transitional housing programs, and the consumer operated services. And we'll be doing that by a number of different ways. So we'll be developing the capacity of people to actively involve in services, so some of the stuff we were talking about. So we'll be providing training, we'll be providing information, and we'll be working with consumers who currently access services. And by doing that, we will, let me take a step back, getting a bit nervous. Okay, so we'll be working with consumers, people who are currently accessing services. We'll be providing a bit of a guideline of what's some basic standards that we see for really participating and hearing the voices of people who access service, and that might be going to a group and hearing what's working and what's not working, to high standards of participation, which might be we have a number of consumers on our board, we get their feedback and their overarching feedback on the actual direction of our organisation. So we're going to be providing some information and support to get people who are accessing services into a space where they're ready to be able to participate in both those spaces. So over the next 3 years, which our project has been funded to do, we'll be providing 30 training opportunities for people currently accessing mental health services in Queensland, and that will be online and across Queensland. Some of them will be face-to-face, some of them will be 5-day intense training, some of them will be short workshops where we might go to services that are already set up, already meet with a number of people and just be there and part of their community. The other part of the project which we'll be doing is then mentoring those people, because there's a big need and there's a lot of call out for more people to be engaged at a more senior level, and we're hoping to get 15 peer ambassadors throughout this project, and we've actually put that within our funding, that we will train up 15 peer ambassadors to be around Queensland, and they will be supported through the Queensland Voice office. They will be paid positions, and they will be supporting both consumer participation, non-government organisations and peer work. So I guess part of the role that I have here is to explain the project, but then the project then hopes to set up people who'll be able to work around Queensland, who'll be able to support this work to continue. The next part of that project is about supporting non-government organisations with information and readiness to be able to handle this and to know how best to approach people, how to continue to support this, how to keep it going. We can provide training and information, but there's some basic things that organisations need to do and some really technical things that organisations need to do to keep that and sustain that. And there's some really value-based things that we might need to challenge about how's this going to work, what's this going to look like, should it be remunerated, all those kind of questions. We need to support organisations and work with organisations to achieve that. And we'll be doing that by providing mentoring to certain organisations and certain key people within organisations to help support that to work. And so obviously we won't be starting with all the services. There's at least, I think, 56 plus organisations that are in the scope of the funding that we're talking about that we need to work with. So we'll be starting with a few key agencies, learning from that, and then taking it back and then working with more organisations. But there will be training for those organisations and services at a base level as well. Aha, good. And the last part is peer work. We'll be supporting peer workers within services through mentoring. We'll be providing training, and for both the consumer participation and the peer work part, there'll be an online platform where there'll be resources, online forums, and a community of practice conversation. So there's a whole lot of silos of different peer work going on out there at the moment, and what we'd like to do is learn from each other, have a conversation about what's actually working, and have a web-based platform, but maybe meet face-to-face and actually talk about how can we support this and keep this going. So I guess that was it from me today. Thank you very much.